You're listening to On The Docket with Napoli Shkolnik.
Hello, and welcome to another episode of On The Docket with Napoli Shkolnik. My name is Shayna Sacks, and I'm a partner here at the firm. And with me is Nestor Galarza.
Hi, nice to meet you. Nestor Galarza, Senior Associate at Napoli Shkolnik.
And we're here to talk about one of the most consequential healthcare antitrust cases that's going on right now. It's called Multiplan. It is an MDL, and we're going to talk about what that means in a few minutes. But whether you're a litigator, a healthcare practitioner, or just someone who's interested in what's going on in the healthcare industry, I think you'll find this very interesting. So, Nestor, why don't we start today talking about who Multiplan is?
Yeah, so basically Multiplan is a company, it's been around since the 80s, right? They're in the healthcare space, doing a bunch of different things as an MCO and different, they've worked as doing different healthcare managing services. And the reality is we have to go back a little bit because Multiplan is a company that's providing services to insurance companies, like the big insurance companies in the U.S., Aetna, your Cignas, your Blues,
Right.
United Health. So back in the 80s and the late 90s, there was a company called Ingenix, which was created by United Health.
Right.
And basically it was a company created for, at least what they did was, provide pricing information to all of the other competitors, right?
Right.
It's United, like I said, the other companies. They were caught, right? I think the New York AG was involved in this as well. And after they're caught, they decided to stop doing this. They created a Fair Health database, which was a database that provides pricing information to, it's very transparent.
Right.
That's why it's called Fair Health, right? And that
It's a good name.
it sort of helped for a while.
Right.
But I guess, we're talking about multi-billionaire companies, insurance companies, so they decided they want to, go ahead and go back to their old ways with Ingenix and use the company called Multiplan to, have access to the information that they shouldn't have access to.
Right.
And that's why, in this case, it's the, the hub and spoke conspiracy, you want to call it. There's an analyst that mentioned, I think it's mentioned in the complaint, that they're basically a mafia enforcer for insurance companies.
Right.
So I don't think they could say it any better than that.
Right, I agree. So since Eugenics, what are the other types of tools? How does it actually work in every day with healthcare providers?
Yeah, so, right, this is involving out-of-network reimbursement. So there's no set prices, there's no contracts. I mean, our clients, we're attorneys for a lot of healthcare providers, many, multiple, hundreds in this litigation. They submit their claims for reimbursement for out-of-network services, and there's no prices in a contract.
Right.
So when they submit those to the insurance company, it might go through different channels, but when it gets to the insurance company, these insurance companies send it to Multiplan, who decides that they're going to reprice it. That's basically what they do.
Right.
Based on the information that they have from all the other companies. They use different methodologies. There's Data Eyesight, Viant. They have various...
Those are the different tools that they use to reprice?
Yeah, those are the different tools, and they've been acquiring them throughout the years. They use those pricing tools. It's algorithms. It's all of this complicated data information that they're using, crunching the numbers, and they'll send it back to your provider. Basically, sometimes we're seeing these massive cuts. Like, they'll might submit a claim for, let's say, $1,000, and they'll reprice it and say, we're going to pay you $100. Take it or leave it.
Or else.
It's $100 or nothing.
Right.
Yeah.
How far spread do you think this is in terms of a harm? Like, what percentage of claims are being repriced by Multiplan right now?
Yeah, it's an interesting situation. What we're seeing is roughly 80% of the market is with Multiplan. There's another company that there's also litigation against them. But the big player here is Multiplan.
Right.
And this is 50 states,
Right.
Puerto Rico, everything. It's the states plus territories, et cetera, of the United States. So it's very, very widespread.
So speaking of widespread, what kind of providers are affected by this? You said it's just out of network. So which providers do we represent? Which providers are most affected?
Yeah, as you know, there's some hospitals in this case.
Right.
The hospitals, they don't have so much out-of-network claims as, it could be emergency services and other things,
Right.
as other smaller healthcare providers, right? But we do represent, substance abuse disorder providers, SUDs. We do have surgeons, we have cardiologists, we have plastic surgeons, we have mental health healthcare providers. We have, I think, one of the clients that we've spoken with, which was a pediatric doctor that deals with cancer for kids.
Right.
And I remember you speaking, with this person. We know it's a massive amount of
affects their business a lot. Yeah. And what about, how is it affecting rural neighborhoods where there's only a certain amount of physicians that are in those neighborhoods?
Yeah, as mentioned in the complaint, and it's been mentioned quite a bit. This is an issue that's really affecting rural communities. We have a lot of providers coming to us. They're saying our businesses are going under.
Right.
We're the only doctor in a widespread miles of areas in the rural areas of the United States.
Right.
We're going out of business. Our patients are going to go to I don't know where.
Right.
We're going to have to close shop. So it's a really terrible situation, especially in rural neighborhoods, rural areas of the U.S.
So let's talk about the litigation a little bit. So there's a multi-district litigation currently, right? Where's that located? Who's the judge?
Yeah, right now this case is in Chicago, so it's Northern District of Illinois. Judge Kennelly is a great judge. Anyone that knows about this, he's very straight to the point. He's very, calls that as he sees it.
Yeah, moves the case forward very quickly.
Yeah, which is great for healthcare providers that are really interested in this case, because this is moving. It's moving quite quickly.
Yeah, very much so. So you talked about different types of plaintiffs. There's two main groups right now that are moving through the litigation, right? There's a purported class, and then there's direct action plaintiffs. Is that correct?
Yeah. So, our clients are all direct action plaintiffs that decided that they want to file their own cases. Obviously, there's the putative class that have their case as well, but we're concentrated on, providing, filing these cases and moving them along discovery and everything, moving to trial. For direct action plaintiffs, which are the providers themselves filing their own individual cases.
Right. Okay. And I know there was a motion to dismiss that was denied, and we're now in the bellwether phase. Can you talk a little bit about what a bellwether is and why that's important and how that can influence things moving forward in the case?
Yeah. And this is something we discussed with other great associates we have at the firm. I like talking about this, and I know obviously we do discuss MDLs with them. So, I mean, in this case, I don't know how many hundreds of providers have filed already. It's to the point, it's so widespread, and we have so many clients that we have to, provide to the court a long list of this number of clients that's signed up and filed. So, the judge in this case would not be able to see discovery and do everything and go to trials for hundreds and hundreds of clients. So they decided to pick a select few number of called bellwethers, bellwether plaintiffs, to move forward with discovery, full discovery, which is helpful for the case. It's helpful for all parties. It's helpful to know moving forward with this case, which, as you mentioned, we've surpassed a motion to dismiss. We're moving along, chugging along in discovery. This is moving quite quick.
It is.
And with these bellwether clients, it's really we believe it's representative of, the healthcare providers across the nation.
Right. So there's how many bellwethers right now going through this process?
Yeah, I believe it's 36.
Okay. And the way the bellwethers are organized, it's trying to cover all different types of plaintiffs, right? So there's hospitals, like you said, there's plastic surgeons, it kind of runs the gamut of each type of plaintiff, right?
Yep.
Okay.
I think on both sides we basically decided, we want to show, this is what we have. These are the providers that are available. This is really what we're seeing across the United States. And like you said, there's large staffing companies.
Right.
large hospitals, hospital systems that are bellwethers. So it's a great
Right.
snapshot of the providers across the U.S.
that are affected. Right. And you said it's across the country, so
Yep.
it's very widespread. Exactly. So what's the schedule right now in terms of trials? We're looking forward to, I think, our first trial in 2028. Is that
Yeah.
right?
I think it's May 2028. Yep.
Right. Which I know may seem like a long time to individuals listening, but with so many bellwethers in such a complex case, I think that's potentially the amount of time that will be needed. So what are some of the types of things that we're dealing with right now in terms of we're setting up for depositions, right? We're working through what other kinds of things are we working through with these clients to make sure that they have all the information that we need to move forward to trial.
Yeah, this is definitely super complex litigation. There's a lot of moving parts. There's things that are going on with defendants. We're requesting from them. Things that are requesting from us. We're at the point we're dealing with documents, gathering documents and producing documents to defendants. There's also a special master that will handle a lot of those disputes that happen.
Right.
The judge also will obviously handle other sort of higher level issues, but this is a case sufficiently complex that we need a special master dedicated just to discovery.
Right.
Because it's like I said, there's a lot of defendants. I don't think we mentioned it, but I think it's roughly almost 30 defendants.
Right. Yeah, you mentioned who they were, but not how
Yep.
many, right? There's a lot of defendants on that side of the room. And just in terms of how quickly the court's moving things, I know 2028 seems like a long time to people, but we have court conferences once a month, I think, right?
That's right.
So the court is really having a tight rein on it and moving it forward. So what are we looking forward to in 2027 and 2028 besides the bellwether trials? Getting some more clients signed on, of course, different types of clients. But I think everything's going really, really well, and I really look forward to bringing some justice in this situation.
Yeah,
It's
and
terrible.
I mean, healthcare providers, I think we're spreading the word. I mean, they do have claims. I know
Everyone has claims. Every physician
and
who does that.
there are so many providers.
Right.
And I know people are coming in all the time, asking questions about this. So what is this litigation? Like, isn't Multiplan involved in my repricing of my reimbursement? I'm getting paid nothing.
Right.
Obviously prices, everything's going up across the country, and then I'm getting paid less than what I should be paid, according to fair health and other parameters. And I think these clients need to know there's a way, or there's potential, people that are potentially interested in this case, there's a way to know if you have claims priced by Multiplan. It's not always so direct and on the nose. You can't necessarily see it just by looking at maybe your EOBs or other documents. But there's always a way to figure out if you do have Multiplan price claims, and you probably do, because like you said, there's 80% is Multiplan. So
I think most entities that you and I have spoken to, as soon as we say the word Multiplan, they get upset. So it clearly has had an impact on the market, and I think this is a great, interesting case, and I look forward to seeing where it takes us. So let's talk about two other types of price fixing related cases that we're working on as well. We have the insulin litigation, which is a multi-district litigation, as well as the generics multi-district litigation. How is insulin and generics multi-district litigation different than the Multiplan litigation?
Yeah, so fundamental thing really is Multiplan, the case is about suppressing prices.
Right.
Our clients are suffering, they're getting paid less.
Getting paid less.
So for the generics and insulin cases, we have different types of clients. This is really price fixing, raising prices on particular pharmaceuticals.
So what kind of plaintiffs do we represent here in insulin and generics different than Multiplan?
Yeah, so in Multiplan, we're representing the actual providers, and here in the generics and insulin MDLs, we represent self-insured entities that provide healthcare benefits to their employees. And this is in municipalities, some private companies, but mostly municipalities, that they decided to become self-insured to provide, healthcare benefits to their employees.
Right. What does that mean to be self-insured?
Yeah, so different to being fully funded, they decide to basically become an insurance company
Right.
themselves. They have a third-party administrator that will administer the plan,
Right.
but they're not paying premiums to an insurance company to
Right.
just provide a plan to the beneficiaries. So it's self-funded. But the thing is, that's the key difference is that they're actually paying per each claim.
Right.
So if there's no claims, there's no money paid. But if there's beneficiaries, incurring costs, and they will cover that on a claims-by-claim basis.
So this is municipalities paying for their employees' health care.
Yep.
Subsidizing
That's
the health care.
correct.
Okay. So we represent towns, cities, counties, things like
Yep.
that. And that's also all across the country?
That's all across the country. We have clients that run the gamut of those different types that you mentioned. We have some private companies, like I said, also. But
Right.
it covers the span of the nation. And also there's other plaintiffs that cover, from coast to coast. So
And the defendants are similar but different in the two litigations. Who are the defendants in insulin?
Yeah, so the insulin case, it's a smaller subset of manufacturers, right? We're not talking about all the tons of manufacturers
Right.
that
Just
are in
those
the
who
country.
make insulin.
Yep. It's really the big three companies, and there's also a specialized type of companies called pharmacy benefit manager, which are very, they're the press everywhere.
Right.
The FTC has sued them for, there's a case involving, insulin price fixing.
Right.
They're in other litigations as well. Sort of been uncovered more recently, their involvement in all of this price fixing.
Right.
They're not necessarily doing the price fixing themselves, but they're getting kickbacks, they're getting money from manufacturers,
Right.
and it's just a way to basically raise prices. I mean, they're involved in the whole scheme.
Right.
So.
And generics is similar but different defendants?
Yeah, generics says, because this is generic pharmaceuticals, this is a
Covers more drugs.
massive amount of drugs.
Because insulin is just for diabetes, so this would be generic, which would be so many more drugs.
It's pretty much everything in the
Pretty
market.
much everything.
Yeah. And there's a larger number of manufacturers that are sued in the case. So that is it's a larger scale multi-district litigation,
Right.
which is in the Eastern District of Pennsylvania. It's been ongoing since 2016, basically.
That's generics.
So, yes, for generics.
Right. And
yeah.
insulin is in New Jersey, right?
That's right,
Also
yeah.
in a multi-district litigation. Okay. And how are in the insulin and generics litigation? Since we're representing municipalities, I imagine taxpayers, that's one of the biggest effects.
I mean,
Right.
as taxpayers, we're paying taxes that go to municipalities, they go to the budget, and they're covering the employee health care,
Right.
and it's going directly into the hands of manufacturers and others. I mean, obviously, you're going to pay for the drugs, but
Right.
these prices have been skyrocketing, and especially in the insulin case. The amount of the raise of the price is just, it's incredible when you look at the numbers.
Yeah, and we hear about price fixing in all different types of litigation over time. My son has a lot of food allergies. There was a lot of price fixing cases about the injections to save his life. Those were skyrocketing. There's a lot of manipulation in the market right now. So between Multiplan and insulin and generics, I guess our hope is to really rein in these companies. It's amazing the effect that they have on the healthcare industry.
Yeah, it's interesting. I was thinking this morning, these companies provide training to their employees
Right.
for antitrust. Now the companies know what to do to not do
Right.
price fixing,
Right.
but they also know what to do to price fix.
Right.
So that's basically what's happening.
Right.
They know how to do it. We're not talking about like in the old days where they would, like the mafia, that they sit together in the dark room and talk about what they're going to do. This is very, very sophisticated.
Right.
And uncovering as plaintiff attorneys, that's part of the job, right? It's
Right.
rough, it's tough.
Right.
But exposing this is really, it's a full-time job.
Right.
And this is these cases are very complex, and we're dealing with huge billionaire companies.
Right, these are like Fortune 5, Fortune 50 big companies that we're going up against.
They
but
know what they're doing, but we also do. So
it has a huge effect on society. So I look forward to the case. Thank you again so much for joining us on the Docket. with Napoli Shkolnik. Make sure you like and subscribe to keep up with everything that we're working on.